Healthcare emergencies can strike at any moment, from natural disasters to sudden disease outbreaks. Being prepared is not just a regulatory requirement, but a moral responsibility. Hospitals and clinics must ensure the safety of patients, staff, and visitors. Effective emergency preparedness helps minimize chaos, reduce harm, and save lives. It also builds trust within the community, showing that the facility is ready to respond swiftly and efficiently. In this video, we'll explore the key elements of emergency preparedness in healthcare, starting with understanding the risks and moving through planning, training, and response. First step in emergency preparedness is identifying the types of threats that could impact your healthcare facility. These might include natural disasters like earthquakes or floods, infectious disease outbreaks, fires, or even cyber attacks. Each facility should conduct a thorough risk assessment, considering both internal and external factors. By understanding the specific risks, healthcare leaders can prioritize resources and develop targeted response plans. This proactive approach ensures that no potential threat is overlooked and that the facility is ready for a wide range of emergencies. Strong emergency response team is the backbone of preparedness in any healthcare setting. This team should include representatives from all departments: medical, administrative, security, and support staff. Each member must understand their specific roles and responsibilities during an emergency. Regular meetings and clear communication channels are essential for effective coordination. By fostering teamwork and ensuring everyone is on the same page, healthcare facilities can respond more quickly and efficiently when a crisis occurs. Once risks are identified and a team is in place, the next step is to develop comprehensive emergency plans. These plans should outline step-by-step procedures for various scenarios such as evacuations, lockdowns, or mass casualty events. Plans must be detailed yet flexible, allowing for quick adaptation as situations evolve. It's also important to include protocols for communication, resource allocation, and patient care continuity. Well-crafted plans serve as a roadmap, guiding staff through even the most chaotic situations. No emergency plan is complete without regular training and drills. Staff must be familiar with procedures and confident in their roles. Drills help identify gaps in the plan and provide opportunities for improvement. They also build muscle memory, so that in a real emergency responses are automatic and efficient. Training should be ongoing, with updates whenever protocols change or new threats emerge. By investing in education and practice, healthcare facilities can ensure readiness at all times. Effective communication is vital during any emergency. Healthcare facilities must have reliable systems in place to alert staff, patients, and external agencies. This includes public address systems, mobile alerts, and backup communication methods in case of power outages. Clear communication prevents confusion and ensures that everyone receives timely instructions. Regularly testing these systems and training staff on their use is essential for seamless coordination during a crisis. Managing resources efficiently is a cornerstone of emergency preparedness. This includes medical supplies, medications, food, water, and backup power sources. Facilities should maintain an inventory of essential items and establish relationships with suppliers for rapid replenishment. Resource management plans must also account for surge capacity, ensuring that the facility can handle an influx of patients during large-scale emergencies. Proper planning reduces shortages and helps maintain high-quality care. During emergencies, patient safety is the top priority. Protocols should address evacuation procedures, shelter-in-place strategies, and special considerations for vulnerable populations. Staff must be trained to assist patients with mobility challenges, chronic illnesses, or language barriers. Clear signage, accessible exits, and designated safe areas are crucial. By prioritizing patient safety, healthcare facilities can reduce risks and provide reassurance to those in their care. Healthcare workers are on the front lines during emergencies, often facing high stress and long hours. Supporting staff well-being is essential for maintaining morale and performance. This includes providing mental health resources, rest areas, and clear communication about expectations. Leadership should encourage teamwork and recognize the efforts of all staff members. When employees feel supported, they are better equipped to care for patients and manage crisis situations. No healthcare facility operates in isolation during an emergency. Coordination with local, state, and federal agencies is vital for effective response. This includes law enforcement, fire departments, emergency medical services, and public health organizations. Establishing communication protocols and participating in joint exercises can improve collaboration. By working together, agencies and healthcare providers can share resources, information, and expertise to manage emergencies more effectively. Evacuation planning is a critical component of emergency preparedness. Facilities must have clear procedures for moving patients, staff, and visitors to safety. This includes identifying evacuation routes, assembly points, and transportation options for those with mobility challenges. Regular drills help ensure everyone knows what to do and where to go. By planning ahead, healthcare facilities can evacuate quickly and safely, minimizing risk to all involved. Not all emergencies require evacuation. Sometimes it's safer to shelter in place. Healthcare facilities should have designated safe areas equipped with supplies, communication tools, and medical equipment. Staff must be trained to secure entrances, maintain order, and provide care under challenging conditions. Clear guidelines help reduce panic and ensure that everyone remains as safe and comfortable as possible until the danger has passed. Infectious disease outbreaks pose unique challenges for healthcare facilities. Emergency preparedness plans must include robust infection control measures, such as isolation protocols, personal protective equipment, PPE stockpiles, and rapid screening procedures. Staff training on proper hygiene and containment is essential. By implementing strict infection control, facilities can protect patients, staff, and the wider community from the spread of disease. Today's digital age, cyber attacks are a growing threat to healthcare operations. Emergency preparedness must include cybersecurity measures to protect patient data and critical systems. This involves regular software updates, staff training on phishing and malware, and backup systems for essential data. By staying vigilant and proactive, healthcare facilities can reduce the risk of cyber disruptions during emergencies. Power outages can cripple healthcare operations during emergencies. Facilities must have backup power solutions, such as generators and uninterruptible power supplies, to keep critical systems running. Regular maintenance and testing ensure these systems are ready when needed. By planning for power disruptions, healthcare providers can continue delivering essential care, even in the most challenging circumstances. Disruptions to the supply chain can have serious consequences during emergencies. Healthcare facilities must build resilience by diversifying suppliers, maintaining emergency stockpiles, and establishing contingency plans for critical items. Regularly reviewing and updating supply chain strategies helps ensure that essential resources are always available, even when normal channels are disrupted. Accurate and timely information is crucial during emergencies. Healthcare facilities should have systems for collecting, analyzing, and sharing information with staff and external partners. This includes patient tracking, incident reporting, and real-time updates. Effective information management supports decision-making and helps coordinate a unified response to any crisis. Engaging with the community is an important aspect of emergency preparedness. Healthcare facilities should educate the public about emergency plans, provide resources for self-care, and encourage participation in preparedness activities. Building strong relationships with community organizations enhances resilience and ensures a coordinated response when emergencies occur. Special attention must be given to vulnerable populations, such as the elderly, children, and those with disabilities. Emergency plans should address their unique needs, including accessible communication, transportation, and medical support. Staff training and community partnerships are key to ensuring that no one is left behind during a crisis. Aftermath of an emergency requires careful planning for recovery. Healthcare facilities must assess damage, restore services, and provide support for patients and staff. Debriefing sessions help identify lessons learned and areas for improvement. Recovery planning ensures a smooth transition back to normal operations and strengthens preparedness for future events. Emergency preparedness is an ongoing process. Facilities should regularly review and update their plans based on new threats, technological advances, and feedback from drills and real events. Continuous improvement helps healthcare organizations stay ahead of emerging risks and maintain a high level of readiness at all times. Healthcare emergency preparedness must comply with legal and ethical standards. This includes respecting patient rights, maintaining confidentiality, and adhering to regulations. Facilities should consult legal experts and develop policies that balance safety with ethical obligations. Clear guidelines help staff make difficult decisions under pressure, ensuring that care remains compassionate and lawful. During emergencies, clear and timely communication with the public and media is essential. Healthcare facilities should designate spokespersons and prepare key messages in advance. Transparent communication builds trust and helps manage public expectations. By keeping stakeholders informed, facilities can reduce misinformation and maintain credibility throughout the crisis. Technology plays a vital role in emergency preparedness. Electronic health records, telemedicine, and real-time data sharing enhance response capabilities. Facilities should invest in reliable technology and train staff on its use. By leveraging digital tools, healthcare providers can improve coordination, streamline care, and respond more effectively to emergencies. Strong leadership is essential during emergencies. Leaders must remain calm, make informed decisions, and communicate clearly with staff and stakeholders. Effective leaders inspire confidence and guide their teams through uncertainty. By fostering a culture of preparedness, leaders ensure that everyone is ready to respond when it matters most. Regular testing and evaluation of emergency plans are crucial for identifying weaknesses and making improvements. This includes conducting drills, tabletop exercises, and after-action reviews. Feedback from these activities should be used to refine procedures and enhance overall preparedness. Continuous testing ensures that plans remain effective and relevant. Emergencies constrain financial resources. Healthcare facilities should plan for unexpected expenses by maintaining emergency funds and reviewing insurance coverage. Financial preparedness ensures that the facility can continue operations and recover quickly after a crisis. By planning ahead, organizations can protect their financial stability and maintain high standards of care. Cultural competence is important in emergency preparedness. Staff should be trained to respect diverse backgrounds and communicate effectively with all patients. This includes providing information in multiple languages and understanding cultural norms. By embracing diversity, healthcare facilities can deliver equitable care during emergencies and foster trust within the community. Managing families and visitors during emergencies is a key consideration. Facilities should have policies for visitor access, communication, and reunification. Clear guidelines help maintain order and ensure the safety of everyone on site. By planning for family and visitor needs, healthcare providers can reduce stress and support patient well-being. Emergency preparedness in healthcare is a complex, ongoing process that requires commitment from every level of the organization. By identifying risks, building strong teams, developing comprehensive plans, and investing in training and resources, facilities can protect patients, staff, and the community. Continuous improvement and collaboration with partners ensure readiness for any crisis. Remember, preparedness is not a one-time task. It's a culture that must be nurtured every day.